Okay. Hi, everyone. My name is Dan Weberg. I'm the head of clinical innovation here at Trusted Health. I'm a ER and trauma nurse by background and have worked in a bunch of different settings across the healthcare system and now at Trusted Health. We'd like to welcome you to this session as we know we're in a crisis situation across the US, and we want to make sure that our trusted nurses are ready and able to go serve the public and get people the care they need during this crazy time. We know that New York is one of the hardest hit areas right now with COVID-19 infections, and we wanted to just go over some tips and tricks and some logistics to make sure that our nurses on the ground are supported and have resources to be able to deliver the care they can. Today we're going to go over a few things. So we're going to go over just some general tips to stay safe. We're going to go over some trusted resources. We'll talk about some of the brand partnerships that we have that can help nurses with their personal health, their wellness, as well as getting some food and things while they're on assignment. And then we'll wrap it up and we can take some questions here at the end. So I just want to thank you for the immense service that you're going to be providing to the public and taking the risk to go into a high risk area. And I thought this quote from Abraham Lincoln actually sets the tone for where the country is right now, and especially for nurses on the front line. So the dogmas of the quiet past are inadequate to the stormy present. The occasion is piled high with difficulty, and we must rise with the occasion. As our case is new, we must think anew and act anew, and we must disenthrall ourselves, and we shall save our country. And I think this hits home, especially for nursing. Nursing's built on a lot of traditions and a lot of procedures and things. And in a crisis situation, we have to put on our MacGyver hats and think a little bit differently. And so we're going to give you some tips so that you can stay personally safe, that you can keep your patients safe, you can keep your license safe, and you can continue to do the great work that you're trained to do as a healthcare professional. So trusted mission, and this is why I think you're with us as well as nurses, but together we can get people everywhere the care they deserve. We've launched a campaign that our marketing leader, Doug, will talk about in a little bit, but of Step Up, Not Back. And those nurses that are stepping up to places like New York, Washington, California, and soon to be a city near you are really exemplifying the profession. And it's an honor to be able to serve you. And we will do everything we can to support you in this amazing work. So I want to go over a couple things, and if nothing else, you remember these 3 points, and probably in this order. So we know that you can't provide care unless you keep yourself safe. And so the number one priority while you're out on assignment and out there in New York is to keep yourself safe. This is safe at work, safe at home, safe on the way to and from work. All of these areas are extremely important. So it's just keep that as your top mantra as you make decisions, because if you are not safe, then you can't provide the care to others that you need to. You also need to keep your license safe. So in a crisis situation, there's a lot of getting things as you need them, kind of hacking around the system. And sometimes the policy and procedure manual gets thrown out the window. But you always, as a professional, need to keep first and foremost that you are in charge of your own license, no one else is. And so make decisions to keep your license safe. And we'll go over some of those as well. And then lastly, why we all do this profession is to keep our patients safe. And so everything you can to keep your patients safe, please do that and keep that in forefront of your mind. These 3 tips, if nothing else, in the middle of the crisis, in the middle of the worst scenario you could think of, try and use these 3 principles to guide your practice. So how do you keep yourself safe? We've talked to several nurses who have been in hard-hit areas, And we actually have a podcast coming out soon where we interview them just so we can provide boots on the ground information from nurses who are treating COVID patients. But there's a couple things that we've learned and a couple tips that have come out of some wellness experts as well as nursing experts who have dealt with crisis in the past. The first one is really to get yourself into a routine. And that's the hardest thing for me as an ER nurse. I don't do routine. I like to kind of, wing it sometimes. For ICU nurses, this may be much more of a pattern of behavior that you like, but it's important that you have a personal routine, and that should include your own wellness as well as your physical wellness as well as your mental wellness. So we've heard tips from nurses that even if it's just a simple 15-minute stretching or yoga routine in the morning to full on, run a marathon, training, exercise, that kind of stuff, it's important to keep yourself healthy and working out to help de-stress as well as keep yourself in peak performance. The second routine, which I think is somewhat overlooked in normal practice, although not all the time, depending on what type of patient population you have, but creating a routine around decontamination. And this is when you leave the hospital or you leave the clinic and you get home, what are you going to do to make sure that you don't bring contaminants back into your own home? And so we've heard stories about nurses getting dressed and undressed in the garage, running right to the shower, even hosing themselves off before they walk in the building. Whatever your routine is, whatever you feel comfortable doing, have a routine that you follow every single time you come home and leave for work so that you don't bring in any potential contaminants into your home, especially if you're traveling with others. The next one is we're hearing long days, stressful days, and even some lack of getting the right foods necessarily. So you sometimes the shelves are bare and you can only get the canned pinto beans instead of the black beans you wanted, or you'll have to make do with some of the vegetables that are available as people stock up for their own health. But think about meal prep before and after shifts. Maybe have your dinner ready that you can just throw it in the oven, or have breakfast set up and ready to go so you can get out the door, knowing that your ability to get in and out of facilities may be longer due to screenings. As you walk in, some facilities are screening temperature and fever and symptoms before you come on shift, and then leaving, having to don and doff all of this personal protective equipment can add time to and from work. And so just be prepared that your daily normal routines may be a little bit longer. And so having food ready to go so you don't have to think about that added stress is always something that's helpful. And then I think the last one is really important as well, which is you need to have regular check-ins. And with Trusted, we have our nurse advocates that are nurses that have been on the front lines, that are still on the front lines in some cases, that can be a check-in point for you. I'm happy to take a phone call as well, or a text or a chat. But have a check-in with family and friends and just be able to de-stress, to vent, to talk through what's going on, because having that mental health check-in is going to be really important, and just get on a routine with that. Whether that's FaceTiming with friends or chatting or even going on Xbox and playing video games, have some regular check-in with people that you care about so that you can maintain your mental health as well. Some ways to keep yourself safe for professional practice. So there's a couple things to consider. I would consider malpractice insurance just as a safeguard. It's really cheap. It's really easy to get. If you're a member of the American Nurses Association, or even not, it's about $100 for the whole year. But it just gives you an extra layer of protection, especially in times where there's crisis and lots of things happen very quickly. It's good to have that extra layer of protection. The second piece is really for you to get comfortable and review personal protective equipment and personal protective equipment alternatives, and how to put them on, take them off, clean them, and potentially even reuse them. There's a lot of great videos online for that. We're going to be sending out an email to you as well with some resources on this stuff. But just get really prepped and think about this. I was talking with a nurse the other day, and we were laughing because, people think the N95 is mask is something that nurses wear every single day in normal practice. And we're like, no, you really get fit tested once a year, and then you never wear it again until now. And so there's certain things that you're going to have to probably do that you haven't done in a while, whether that's N95 masks or it's PAPR hoods, or it's certain gowns, surgical gowns, and those type of things that you may not wear in everyday practice. Just get familiar as you're driving across the country, you're flying, whatever you're doing to get to New York. Think about reviewing those things, and I'll provide some links for you as well so that you can watch some videos just to get super comfortable with that, because it's going to be key for your safety. And then the last piece of this is really a personal check, but you have to think about what you're comfortable doing and what you're trained to do. And so as you walk into really the battle zone of the front lines of this fight, you need to think about what you're competent in as a professional, what you absolutely cannot do, and be very clear about that in your own mind, because at the end of the day, you need to protect yourself. And by protecting yourself and your practice, you can deliver care to more patients. So be thinking about those type of things as you go into this, so you're not having to make last minute gut decisions. Keeping your license safe is also super important. So it's always good as you go to a new state to look at the Nurse Practice Act if there's any weird things related to practice there. I couldn't find anything that was off the charts weird in New York, but it's always good to just have a review of that. With that being said, also know your knowledge limit. So you may be asked to float to different units. And so you need to be really clear about what you're competent in as far as skills. And so when you get asked to float from an ER to an ICU or an ICU to a COVID unit, be really clear about what skills and what types of patient and what acuity they have. If you're not comfortable running a ventilator, then you need to refuse those patients and be able to do and ask to do something else within your competency. If you're not comfortable giving certain medications or you've never been trained on different setups and pumps and things, you need to be able to voice that to the management team so that you're not taking on something you're not able to do, because that will eventually that will eventually be something that could be brought against you in the future. So just know your limits. You know these things because of your specialty, but it's okay to say no or I don't know that, and being able to speak up like that is going to be really key. Ask tons of questions, especially on day one. Get comfortable with everything from where's the code cart to what are we doing about PPE when it gets low or if it gets low, to what's the procedure, what are the codes for all the crises and those type of things. You need to ask lots of questions there. Will you float? All of those things will be key so that you're not caught off guard if an influx of patients come in or there's not resources to ask those questions on day 2, 3, and 4. So get very comfortable, ask lots of questions, probably write them down as well. And then the biggest piece to get oriented on is PPE on day 1. So specifically call that out, ask where it is, how you get it, which form it comes in, how you're going to put it on and off, where do you throw it out, where are the negative pressure rooms, all of that stuff is essential on day 1. And we'll be sending you some resources for your trip over so that you can review these in real time as well. And then this is just because my spirit animal is MacGyver. You're going to have to think differently in a crisis situation, especially with the numbers of patients that are flooding New York hospitals at the moment. You need to think like MacGyver. So you may not have all the right equipment. You may not have all the right people. You may not have access to the information the way you normally have it. So you need to be able to think ahead of time and be able to put things together quickly. And ultimately, it's about working safely, speaking up, offering help, and asking for help. If you just follow those 4 things, you're going to be really great. I would love to sugarcoat this and say that it's going to be just run-of-the-mill assignment and you're going to be making that crisis pay and going home happy. But there's going to be hard decisions. And if you look at what happened in Italy and what's happening in New York now, there's really tough decisions that you may never have faced as a practitioner. And so it's important that you speak up, it's important that you advocate, and it's important that you communicate with us at Trusted as well so that we can help you in any way that we can. Ultimately, you need to prepare for the worst and expect the best, but the worst could happen. And I want you to understand that that's a strong possibility. And so if you haven't trained or read up on what happens in disaster scenarios with with mass casualty scenarios, it would be good to review that. And I put a little picture here of what that could look like, but this was happening in Italy, and it potentially can happen in New York as well, where as people present to the emergency room or to the tent outside the emergency room, they'll be given a color. And that will be, we can save them, they can be delayed, and we might be able to save them. Minor would be go home. And some you may be having to decide life or death in a split second and move on, even if they're still alive at the moment. And so that's a tough thing to do. And so while it may not happen, it's important that you start thinking about that and getting ready to be able to have those conversations and have that possibility occur. So it's not doom and gloom, but it's important that as a professional, you understand how those decisions are made, because you may be asked to make them. And so this is why, we're a support for you, but it's also important to have that outlet at the end of a shift to be able to release some of the emotions and things that will happen. We have some details coming out soon, potentially where we can link you with some great support, but just be ready mentally to go into a situation, prepare for the worst and expect the best. So we're going to go over a couple trusted resources now. So I'm gonna take this first slide and then I'm gonna hand it over to Chelsea, one of our nurse advocate leads, to tell you a little bit more about the logistics related to Trusted in your assignment. So just a couple things. We got your back. Trusted is a nurse first company. There's a number of our nurse advocates on this presentation right now that are listening and ready to support you. You've communicated with them. We are 100% nurse first. So your nurse advocate is there for you. In fact, the entire company of Trusted is there to support you in any way you need. We've built a Trusted COVID-19 resource page that Doug will talk about in a few minutes. We offer 14 days of quarantine pay. So if you're exposed and your facility says, hey, you can't work for 14 days, we got you. We're going to pay for those 14 days. No problem. We just have a couple forms that need to be signed, but we got you. So don't stress about that. Go give the care that you need and you know how to give to those patients without having to worry that you might be off for 14 days without pay. We got you. We'll talk about some brand partnerships. And again, we're nurses helping nurses. We're a company built with nurses at the forefront. We have about 20 or so on our team now, and they are your frontline contact as you go into your assignment. So use us, communicate with us a lot, because we are here to support you. So I'm going to turn this over to Chelsea to talk a little bit about the trusted resources and some logistics of your assignments.
Thanks, Dan. Hey, everyone. I really just am going to cover some of the basics more on the contract. And as far as what to expect on the next slide, we'll talk about, quarantining or if you're exposed. But just to echo Dan, we're definitely here to support you guys. Our whole team of nurse advocates are here to answer you when you need it. We know these are tough times and we want to be right there with you on the front lines. While we're not at the bedside, we're very much engaged here and appreciative of everything you guys are doing to care for these patients in need. So with that being said, just jumping into our resources, you guys, I know some of the trusted nurses on this call, some of you guys have already signed, and this may be information you've already heard. Others are not necessarily signed up just yet. So I want to cover things that your nurse advocate probably does and just review them, and definitely feel free to ask questions at the end if there's anything that I can be more clear on. But kind of high level, you'll all download the Trusted app, and your time is due by 12 p.m. on Sundays. And you'll just enter that for the shifts that you've worked. Your benefits kick in. If you haven't already, you'll be receiving an email from ADP to get this set up. And we also have an employee assistance program that's on our resource guide that offers some resources just for mental health and things like that as well. Your sick time begins accruing the first day of your assignment. So this won't kick in until your 90th day of employment. and you'll accrue an hour for every 30 hours that you work. So it can't be used during your first and last weeks or any week with time off or holiday. And then as far as guaranteed hours, so your contract will always state the guaranteed hours policy, and that'll apply. They will not apply during weeks of the holiday or any scheduled time off. So I know with the traveling and everything going on with COVID, there's been some time off that was removed. If that happens, just let your nurse advocate know ahead of time, and they'll talk you through how we document that to be sure that your hours will be guaranteed those weeks. And then as far as reimbursements, so Dan actually mentioned the malpractice insurance, and for New York Health and Hospitals, they actually do require that our nurses get this. This is something we'll reimburse you guys for. And we often direct our nurses to the Nurses Sources Organization, so NSO. And it'll be about $111, and you can just forward that receipt and we'll take care of that reimbursement for you. On top of that, we don't reimburse for any certs that aren't typically required, or any licensure renewal. So, for BLS, for all specialties, that wouldn't be something we reimburse for. Same thing with travel, and we formulate our packages to give you as much as we can up front as far as pay. And if you have any follow-up questions on that, I'm happy to answer. You can always let your nurse advocate know as well. And then COVID specific. So these are things we've been running into, whether it be New York or not, and just kind of want to run you guys through what it'll look like if you start to experience any symptoms or are asked to be quarantined. As far as symptoms, so really this is based on the facility, same with the quarantine. While, one manager might request one thing, it's not actually up to us at Trusted or yourself to self-quarantine based on symptoms and or exposure. So definitely notify your manager if you start experiencing any of the symptoms in your nurse advocate. And then your facility will determine whether or not you will be quarantined and for how long. And then if that's the case, again, let your nurse advocate know. We have a form that they'll fill out, and your manager will just mark when does that quarantine start, how long do they want to quarantine you. We've seen a variety of these happening just really based on facility. And then we will reimburse for your quarantine for up to 14 days. And I will flip it over to Doug, I believe.
Cool, thanks, Chelsea. Good to meet all of you guys. So we created a COVID-19 Nurse Resource Center. And really the point of this is to create a place for nurses to go to get accurate and verified information about all things kind of COVID-19 related. Just with all the misinformation and the speed at which things are kind of moving, we really want to be able to create this kind of central resource for all you guys. And so if you go to this page, what you'll see is up-to-date information on changes specifically to like policy and state licensure. Just about every day, there's a new state kind of changing their licensing policies or things like that. And so we're updating this page really regularly. Other stuff that's on here is other resources for nurses. So we have several blog posts that we think are going to add value, especially with kind of this influx or kind of spreading of COVID-19. Blog posts around dealing with burnout or mental stress. We also have links off to CDC and WHO, as well as a link to Johns Hopkins to be able to track kind of all the cases kind of across the world. In addition to that, we also have links to the Trusted Action Plan, which we've kind of talked a little bit about already, but that's just really a kind of longer form version of what Chelsea called out around Trusted guaranteeing that we'll pay for any quarantine pay, as well as some other employee assistance programs. And then the fourth piece that's on this page is our social media campaign to really kind of highlight and showcase all of the nurses like yourselves who are really stepping up to fight the spread of COVID-19. And so, we're asking people to share their stories about why they're stepping up and really kind of leaning into the fight. And then we're featuring a number of them on our landing page here on the Resource Center. And then we'll also have a feed on Instagram of all the people using the hashtag #StepUpNotBack as well. And then the last piece is around our brand partnerships and promotions. So what these are some exclusive partnerships that we've lined up with a number of companies in order to kind of continue to support you all. And so if we go to the next slide, yeah, there we go. These are all the partnerships that we have. Some of them are kind of across the board. Some of them are exclusive just to Trusted. So Cold Brew High Brew Coffee is a company out of Texas that we're partnering with. They're offering all of our Trusted Nurses a free case of coffee, of cold brew coffee. And so if you go to our resource page, you'll see, you'll be able to find a link to go and claim that case of coffee, as well as some of these other companies. Again, all of these details are on the website. But another one that I wanted to call out was Uber Eats, which is, again, another exclusive partner to us. They're offering all of our Trusted Nurses $25 to any Uber Eats in their locally. And then some of these others, maybe you've seen, but we really want to create the central place. And so we'll be updating this as we kind of go through, all of the COVID-19 kind of response. And we'll be adding any new ones that we kind of come across and be featuring them here. So feel free to shoot it to us if you guys come across one that's not listed. And yeah, that's the COVID-19 Resource Center.
Awesome. Thanks, Doug. And just finally, I want to thank you for all you do. As nurses on the front lines, you're essential in the fight of the COVID crisis and care even outside the COVID crisis. So we are so thankful that you've chosen to partner with Trusted. We are here to support you. We have multiple resources for that. And we'd love to hear your story as well, because that helps us get resources and more nurses to the right spot at the right time. So thank you for stepping up and not back. And with that, we can take some questions. And you can use the chat option or unmute yourself and talk on the phone. Either one's fine.
Hi, my name's Jessica. I'm from Idaho, and I just got to New York today. Woot! My question, I guess, is for Chelsea. There was something that we're supposed to do, and I think I was daydreaming because I am not sure what it is I'm supposed to be doing.
No worries. Hey, Jessica. I'm glad you got there safely.
Me too. Long drive.
I was going to say, where did you drive from?
Boise, Idaho.
Oh my goodness. Wow. How many days ago?
I left Thursday afternoon and got here this afternoon. So not too bad.
You're allowed to be daydreaming, let me tell you. That drive. So I had really just reviewed some general information about your contract and guaranteed hours. The one action item you're probably thinking of is the malpractice insurance. If you just go to nso.com, you can purchase it. It's $111, and that's something we'll reimburse you for. I just wanted to make sure that was clear. And I know we've been working with Lindsay to also help get onboarded, and she's happy to answer those questions. And as well as your nurse advocate, but I just wanted to be sure it was clear that we'll reimburse you for that $111 insurance.
Okay, perfect. I will get that taken care of. Awesome. Thank you, Chelsea.
You're welcome. Thank you.
Thanks, Jessica. Any other questions? All right. Well, thank you again. And if you have
wait a minute. Sorry, it's Jessica again. Is there anybody else who's going to be at Harlem with me tomorrow?
Yeah, that's an awesome question. I'm happy to look into that. If you guys feel like it'd be